Alrighty, so you're here to see us for a breast augmentation pre-op. Stacy's going to be the one seeing you in clinic and helping you with a lot of aspects of that, especially implant sizing. So with breast augmentation, implant sizing is something that's sort of unique to breast augmentation, and she's very, very versed at helping you with that, helping you choose those sizes. She's going to have you try on sizers, have you put on a bra, have you put on a t-shirt, and really figure out exactly what it is you want. Remember, some of that sizing is going to be based on what's going to fit there and what's going to be safe. And so she'll remind you of those things that we talked about in our consultation to try and help guide you and help you choose the best, safest size for you. The other thing she's going to do in the pre-op is she's going to take photos of you. We use those photos that we take when you're disrobed. We use those photos that she's taken of you in our operative blah, 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 blah. Let me start one more time, sorry. Alrighty, you're here to see us for a breast augmentation pre-op. Stacy's gonna be super important in helping you do that, especially she's important in one aspect that's unique to breast augmentation, that is sizing. When you come in, she's gonna help you try on different sizers, and she's gonna put you in a bra and in a t-shirt and help you see just what size each different size in cc's is gonna make you. She's going to remind you of the sizes that we talked about in our consultation and what's going to be safe and what might not be safe for you, and try and steer you in a direction that's going to be as safe for you as possible. And that is our way of helping you decide exactly what implant size is going to be best for you and going to fit you. If during the sizing process you still have some questions and concerns, or you don't feel like it looks exactly like you were thinking, or you want to communicate more with me, remember, you will see me again right before surgery. You and I will always talk before we do a breast augmentation. I'm going to mark on you prior to surgery, and we're going to go over sizing again and incision we're going to use again to make sure we're doing exactly what you want us to do. And if at that time you need to communicate more things to me, like giving me the right of way to make decisions based on what I see, or showing me photos of here's what I'm trying to achieve, here's the size Stacy and I came up with, but I think this picture depicts what I want to sort of project when I'm done, then I can use that information, any extra information you give me, to try and achieve exactly the size you're looking for during your operative procedure. Additionally, during your pre-op, Stacy's going to be taking photos of you. She'll ask you to disrobe. She's going to be taking photos of your breasts without any bra on, so that we can see those differences that are present when you're standing that may not be present when you're laying down. As you know, when you lay down, your breasts look very different than they do when you stand. And so being able to see both of those side by side at the same time during your operative procedure helps us to get the optimal outcome for you. She's also going to be giving you some medications. And those medications, typically there's 3 of them: an antibiotic, which we're going to give you during surgery and for you to take home and use after surgery for 3 days. She's going to be giving you a pain medicine, which is usually a narcotic, usually Norco. But if there's something different that works better for you, she'll give you that. And she's going to be giving you an anti-nausea medicine. Both the pain medicine and the anti-nausea medicine are things that patients from a breast augmentation don't take a lot of typically. Typically, there's not a lot of pain with this, and if you keep your arms stretched, as we're going to tell you exercises to do to stretch your pectoralis muscle, if you keep doing that after surgery, most of you will not experience a tremendous amount of pain. It will feel like pressure is on your chest, but not usually really painful, so you may not take much of that medicine, but we ask that you take the antibiotic after surgery till it's all gone. And also, you're going to receive a packet from Samantha. She is our patient coordinator. She's going to give you a packet that has the breast implant, what am I looking for? Concerns and the information regarding breast implants. Sorry about that. And also the risks and complications. And Stacy will tell you a little bit more about that and the importance of that.
You will receive that via email from our coordinator once you schedule your surgery. So that way, make sure you're looking for through your email. You may receive it in your junk email, so make sure you look in there. And you just want to make sure you read through it thoroughly before you come in for your pre-op appointment, because you will be signing those consents that day. We also ask if we have requested for you to get any pre-surgical labs or an EKG or anything, a medical clearance from your primary doctor, that you do that prior to your pre-op visit. Super important that you do that to make sure that it doesn't cause a delay in your surgery. Medications, I always advise you once I prescribe them to get them a day or two after I prescribe them. Sometimes there's an issue with the pharmacy and we don't want you to have to come in the day of surgery and not have your medications. So those are things that we just cover again and just reiterate when you come in for that pre-op appointment.
And one thing that the word I was looking for that I wanted to be able to mention is, with a breast augmentation, there is an additional packet that the patients will get. Do they receive that at the pre-op, Stacy, or at the surgical procedure time?
I believe we're sending it to them via email as well.
Okay.
And then they will sign that. That's a separate thing from the actual company.
Okay,
right,
so that's extra information for you to read about your implant as well. So you have that knowledge about implants, and that talks about everything. It's a big leaflet that has a whole lot of pages, so it's a lot of information for you to read. But it's the straight scoop on implants to try and give you the most information we possibly can about implants, and again about your consent forms and your packet that you get with that. Make sure you read it so you come to us with questions so we can answer those for you. You were going to say something, Stacey.
One thing too, also there is a warranty that you can purchase after you get your implants placed. We do discuss this and advise patients highly to think about purchasing that after surgery. You won't do that until actually after surgery and you have the serial number from your implants to be able to contact the manufacturer directly, and then you buy that extra warranty. Covers kind of, some of the risks that are involved with breast augmentation, capsular contracture. You can buy an extended warranty that will cover if you were, say he was going to have to go back and replace your implants. 10 years after surgery, it will cover capsular contracture. It will cover the implant and the cost of the surgery.
This can be super important because unlike a lot of warranties that you may hear about when you buy equipment or buy a car that seem to be very, very expensive relative to everything else, this warranty is relatively inexpensive relative to your surgery and can really, really save you if you do have one of these problems. Even though they're uncommon, if you do have one, having to pay for surgery again is a bummer. We don't want you to have to do that, and just for a couple $100 you can get this warranty and it covers these things for you. And so that's awesome. It's a really awesome warranty. I don't usually buy warranties, but I would get this warranty if I was having this done. So that is your breast augmentation pre-op. There you go. Hope that answered your questions for you.